The polio vaccine, Jonas Salk's fight against poliomyelitis. In the annals of medical history, few stories are as compelling and transformative as the development of the polio vaccine by Jonas Salk. This narrative not only chronicles a pivotal moment in public health, but also highlights the relentless pursuit of a scientist against the backdrop of a world gripped by the fear of poliomyelitis, commonly known as polio. The disease, characterized by its ability to cause paralysis and even death, became one of the most dreaded illnesses of the 20th century, particularly affecting children. The journey to the vaccine's creation, its widespread acceptance, and the eventual decline of polio incidences is a testament to human ingenuity and perseverance. Jonas Edward Salk was born on October 28, 1914, in New York City, to Russian Jewish immigrant parents. His early interest in science and medicine led him to the New York University School of Medicine, where he chose to pursue medical research rather than a more lucrative career as a practicing physician. His dedication to understanding and combating infectious diseases set the stage for his life's work. The polio epidemic in the United States reached its peak in the early 1950s, with thousands of cases reported annually, leading to widespread panic. Public health campaigns aimed at controlling the spread were only marginally effective, and the nation clamored for a more definitive solution. The March of Dimes, a foundation established by President Franklin D. Roosevelt, himself a polio survivor, became a key player in funding polio research, setting the stage for Salk's groundbreaking work. Salk, then working at the University of Pittsburgh's Virus Research Lab, focused on developing a vaccine using killed virus strains, a method considered safer than the live virus approach pursued by other researchers. His strategy was grounded in the belief that an inactivated virus could still provoke the immune system to produce antibodies against polio without causing the disease itself. In 1952, Salk and his team began testing the vaccine on a small group of volunteers, including himself, his wife, and their children, demonstrating the vaccine's safety and efficacy. The results were promising, leading to a national trial in 1954, which would become the largest public health experiment in American history. Over 1.8 million school children, part of a group known as Polio Pioneers, participated in the trial. The success of the vaccine was announced on April 12, 1955, a day met with widespread acclaim and relief. The vaccine's effectiveness in preventing polio was undeniable, leading to its rapid adoption and mass immunization campaigns across the United States and eventually around the world. Salk was hailed as a hero, though he famously refused to patent the vaccine, stating, "Could you patent the sun?" This decision underscored his commitment to public health over personal gain. The introduction of the polio vaccine marked a turning point in the fight against infectious diseases, showcasing the power of vaccines to control and potentially eradicate major public health threats. Salk's work paved the way for future vaccine research and development, setting a precedent for medical innovation driven by a commitment to the greater good. However, Salk's journey was not without controversy. His refusal to patent the vaccine and his approach to its development, bypassing traditional live virus methods, drew criticism from some quarters. Moreover, the rivalry with Albert Sabin, who developed an oral polio vaccine that later became the standard for mass immunization campaigns, highlighted the diverse path scientific research can take toward a common goal. Despite these challenges, Jonas Salk's legacy endures, not just in the near elimination of polio as a public health threat, but also in his ethos of service to humanity. His work exemplifies the impact one individual's dedication and innovation can have on the world. Today, as global health initiatives aim to eradicate polio entirely, Salk's vaccine remains a cornerstone of these efforts, a reminder of the journey from despair to hope, from disease to health, and from fear to freedom.